In the early morning of October 9, 2017, the residents of Sonoma and Napa counties awoke to quick-moving wildfires heading straight for their neighborhoods. Many had just moments to flee, most with just the clothes on their backs. Others would not make it out alive. In all, more than 8,900 structures were destroyed and 44 people lost their lives. At Kaiser Permanente Santa Rosa Medical Center, physicians and leaders decided quickly that they would evacuate the hospital as the fire was heading straight for them. In the span of 3 hours, 130 patients were evacuated to other Kaiser Permanente and community hospitals via ambulance, bus, and private vehicle. The fire department had decided to make a last stand, pouring their resources and water on the flames to protect the hospital. It worked. As Kaiser Permanente physicians and leaders throughout Northern California awoke to the news of these wildfires, many of them quickly went into crisis mode to help our Kaiser Permanente colleagues in Santa Rosa, as well as support in our Napa and San Rafael facilities, who were also being impacted by smoke, an influx of patients, and the overwhelming situation that was happening in our own backyard.
It was about 2:30 a.m., and I heard the phone ring, the cell phone ring. It was a Monday early morning. Not awake, picked up the phone, and all I heard was there are fires in Santa Rosa and Napa, and we need to evacuate the Santa Rosa Kaiser Permanente building. Picked up the phone and I called my physician in charge to say, and he was new. Chris was, it was his day one of the job. It was Monday morning. We're going to celebrate him being the new PIC for Napa Solano. And my first conversation with him in that morning was, Chris, congratulations on your job, but we've got a bigger task on hand. And it brought all of us together. I acknowledged, Chris, he drove up to Napa in that thick smoke to see how he can help at the Napa clinic. And many, many volunteers, many of our staff were there ready to help our community.
I woke up on Monday morning, October 9th, to the sound of my cell phone ringing, and I picked it up, and it was Nor Jemjemian, our area manager. And I think it was actually one of the first time we'd actually spoken on the phone. And in fact, it was my very first day as the newly elected PIC for Napa Solano. In fact, I hadn't even been ratified yet. And Nor told me, he said, there's a fire in the Napa Valley and a fire in Sonoma, and it looks pretty bad. I drove up to the clinic and I walked up to the door. And as I walked up, I saw a crowd of people inside the clinic. And as I walked in, there were a crowd of probably about 50 individuals standing in that clinic, all dressed, ready to work, most of whom had evacuated out of their homes, many of whom had packed cars and families in hotel rooms, but ready to help with whatever was going to happen in Napa County. And I'll remember that moment forever because it was pivotal for me to know that I worked with people that, regardless of the fact that their homes were in peril, that their families were in danger, that they showed up. They were people who showed up for their community. And it was this moment for us in Napa Solano where Nora and I began to work together very fluidly. Our teams began to work together very fluidly. There was no KFH and TPMG. And very quickly, things began to happen in ways that were what I would say are miraculous. And in fact, our teams, and I'll name a few names, though I certainly will miss people, but our teams like Dr. Charles Clary and Dr. Lisa Kuhlman and her team were out at the fire sites and at the evacuation centers literally before the Red Cross showed up. And I really believe it did a couple of things. I think it set a foundation for who we are in this community, that we are the people that stay and we are the people that show up. It set a foundation for the teams, the KFH team and the TPMG team, that we are one team and that we show up together. And most of all, it really showed the individuals that we work with We have individuals who are parts of this team that came together, worked day and night to sacrifice for their friends and their neighbors so that they could have comfort, so they could have care, so they could have peace of mind. And it moved me, it defined me in this role, and it will be something that for me is a bookend, both in my career as the physician in chief and just in my career as a leader in Napa Solano.
In the Napa Solano area, our first priority was to make sure our patients were safe and secure. Our Napa facility, while not damaged, was without power and had very poor air quality. The decision was made early on to cancel all but urgent appointments. 2 evacuation shelters were set up in Napa, one at Crosswalk Community Church and another at Napa Valley College. We quickly deployed supplies and staff to help those people who had been displaced and really didn't know when they would be able to go back to their homes or if their homes would be standing.
Initially, once the doors were opened, we set up clinic the best that we could with no electricity. Unlike the earthquake that happened in a 20-second period, these fires lasted the whole week. Our ability to assess our community's needs and work with our other care providers like Queen of the Valley Medical Center and Napa Valley College was an essential part of our response.
For me, I was born and raised in the Napa Solano service area, so this is home. I spent the first 15 years of my Kaiser career at the Napa Medical Facility, and so it was only natural for me to head to Napa and help support the Napa facility during this time. We canceled all of the routine appointments in the Napa facility, and we were able to cobble together an area so that we could provide urgent care and then medication replacement for those people who many had to flee with only the clothes that they had on their back. There's so many moments, despite all the horror and devastation, these moments of gratitude, of camaraderie, of heroism. But for me, I think the one thing that I'm going to carry with me for the rest of my life is watching the people that I have the honor of calling my colleagues every single day care for the community that they love, but more importantly for each other.
Soon we were working alongside the Red Cross and Salvation Army to provide basic needs for evacuees. We also had a strong response from our mental health professionals who were there to support evacuees during a very stressful and uncertain time.
So that was my big push, is to get the community members access to care quickly. Then we learned there were evacuation centers, so a doc was sent up to Calistoga and one to the Crosswalk Church here in Napa, where there was a small shelter. And then I went down to the community college where a larger shelter was unfolding. And so as soon as I got there were literally hundreds of people walking around, having most of their needs met. So food, clothing, and shelter were handled because Red Cross was doing a superb job. We had a local chef here with Salvation Army preparing meals. And so most, if not all of their needs were met, and cots were being assembled quickly. They had places to sleep. I had an idea that we could call Clinical A and have one of the physician representatives come with a laptop to the shelter and one from the Queen of the Valley. And if they were represented and Kaiser was already there in force, we would be able to immediately set up an integrated model where patients could come up and just give their name and date of birth, and we'd find out what medicines they had, where their pharmacy was, what allergies they had. And that worked very well. We got that system up and running in less than a day. A significant amount of money was donated, and I took them in the form of Walmart gift cards because Walmart has hundreds and hundreds of prescriptions for $4 a month. And so after calling the pharmacist in Walmart, he and I have known each other for several years, I told him we'd be sending a number of patients over, but if patients didn't have money for the medicines, we'd give them a gift card and we'd get them transportation.
So after the fire started in the Napa County, I was asked to be part of the group that worked out at the Napa Valley College. And the time that I spent out at the Napa Valley College was some of the most inspiring moments that I've ever had since I've been part of Kaiser Permanente. When we first started out, the shelter, there weren't as many people there, and so we were trying to kind of find our bearings and figure out the best way to do things. And all in all, by the time we were done, there was 600 people out at the shelter. Many of them were staying in the gyms. There were 3 separate gyms that they ended up opening. And then a lot of people actually even were staying out in their cars. I remember one story where we were giving out gift cards to people to go pick up their medications. And the gift cards had $20 on them. And so we gave one of the people staying at the shelter this $20 gift card to go pick up their medications. And they actually brought the gift card back with money on it after they purchased the medications. And this is someone who they don't even know what they're walking back to. And they're bringing this gift card back to us with money on it so that we can share it with someone else so they can get their medications too.
I was really glad that Kaiser gave us this chance to do even a little bit during that hard time.
Many of us were inexperienced at disaster medicine and just disaster, sort of aid, disaster volunteerism. And so it was notable that we all learned that together. In the early hours that I was there volunteering, we had lots of help, we had lots of supplies, and we have very little organization to all of it. So after a couple of hours, several of us doing that, running around and taking care of just kind of anything that popped up, we all kind of looked at each other and chuckled and said, well, here we are, a bunch of doctors, and we had some nurses and medical students and residents, and what we really need is a clinic director. And so we looked around at our group and decided not to pick one of us to run the clinic, and we decided to pick one of our administrators, Andrew Muck, and we turned to Andrew and said, Andrew, this is perfect for you, to help us to organize this. So within a couple of hours, we were doing pretty well. And by the time I came back the following day, clinic was running super smoothly. We had it looked like, well, it didn't look like one of our Kaiser clinics, but it ran like one of our Kaiser clinics.
Working at Napa Valley College during the fires was a life-changing experience for me. Anybody who knows me knows that almost all of my career has been in outpatient peds with a short stint in mental health nursing. So going to this center that had just been filled with all of the evacuees from Calistoga and really had become a center for the elderly and infirm was a little bit scary to me to begin with. What I discovered was that nursing stuff is still there, and that was very good for me. It was also good for me to see just how incredibly wonderful people become in an emergency. I mean, we're all good people, but it was amazing to see people like Dr. Clary, who was there constantly and was always affirming and appreciative and there to help in any situation. There were other people that I really want to recognize. Angie Garcia, in the first couple of days, anytime we needed something, we would call her and she'd figure out how to get it there. And then they assigned Andrew Muck to be that person. And Andrew was amazing. Andrew not only got us what we needed, but he also cataloged everything that we had gotten there and then put together a document so that if we ever have to do something like this again, we won't have to make it up as we go along like we did this time. We'll be able to have something to build on. And that was amazing.
As Kaiser Permanente started to help in those shelters, I asked my boss regionally if I could step away from meetings, come back to my home facility, and just take care of patients. Luckily, he said, of course. And so I dropped my whole week. My family and I moved in with a girlfriend so that we knew we would be safe while all of this occurred. and then just spent hours at the shelters caring for our members, non-Kaiser Permanente members, but who are still members of our community. And I think what was important is to see that in every part of our organization, we came together. There were nurses there with doctors, with pharmacists, with administrators. It didn't matter what part of our organization you were from. It didn't matter if you were KFH or TPMG. We were just really that one shared agenda of Kaiser Permanente coming together to take care of our community. It calls a higher purpose. It bonds you in ways that you can't bond otherwise. And there are people here that you can rely on no matter what. And I think that was as important as it was for our community. It was important for us internally too, to realize we had that strength and that level of support with one another.
At the church that I attended, St. Apollinaris in North Napa, I went up there the following night and realized that there was a center that was set up mostly for farm workers. The word we got about why they were there and not down at the Napa College was because many of them may have been undocumented and were afraid of moving to a center where the federal government, where FEMA was. And so they decided to stay at more of a safer place. There was very limited medical care at that facility, and I was able to work with nurses from the local parish as well as from one of the Kaiser Hospice nurses who I know, Angela, who she and I worked together. We found one gentleman who was probably in his mid to late 20s, who was an insulin-dependent diabetic, but had told nobody about it. And he was afraid of bringing it up. And so we had worked with a translator and gained his trust. And he, as well as a couple other people, told us that they had diabetes, but they had no medication. They had to leave so quickly, they were forced to leave their medications behind. We were able to call into a local pharmacy to get the insulin, and then with the help of people from the facility, able to go get it, pay for it, and bring it back to him and prevent him from having to be in the hospitalization or from feeling badly. I went to one gentleman's house. He was a very nice man who lived with his wife in West Napa, Northwest Napa. He was morbidly obese and an elderly gentleman, and he wasn't able to get out of bed without significant amounts of bariatric transport. So his wife didn't know what to do, and their phone lines and electricity went out because of the fire. So I was able to go to the house. We have made sure he had enough medications. I made some medication adjustments in order to help with his respiratory issues that were happening from the fire. Our team, from Catherine and Annalisa and Grace, myself, all of us kind of got together and devised a plan to assess the risk of each patient in the nursing home and what transportation method would be best in order to help evacuate them if the need arose. Another thing that stands out to me is working with Dr. Charles Clary, who was just showed amazing leadership skills and helped not only with the organization of the Napa Valley Care, not only with the organization of the Napa Valley College Evacuation Center, but also one night when I was there with him, there was a baby who was having some respiratory distress, and he assessed that baby needed to go to the hospital, but paramedics were busy. He had put the mom and the baby in his car and drove them to the hospital himself, and that's, the kind of people we have is we'll do whatever it takes to take care of people in our community.
After being notified about the fire and the opening of the command center, in my mind, while I was driving to Vallejo, I started adding up all the patients that we have in the continuum. And I added how many patients we were caring for currently in home health, hospice, the skilled nursing facility, how many patients are getting their dialysis, how many patients we are case managing from our transitional program. And by the time I added all of them up, we have 700 plus patients. So we pulled our team together in the continuum, and we had opened a command center at Park Place. We had called all of our patients in hospice and home health. In hospice, we had 63 patients. In home health, we had 320 patients that we had to call. And it took us 3 days to get to all of them. And by the third day, there was only 3 that we couldn't get to. And those 3, turns out they were fine. We had Dr. Mason actually go out to visit one of the patient on his way home. And the other 2 patient, our clinical supervisor went to visit the patient on her way home that night. At 4 o'clock, I got a call that the evacuation centers needed wheelchairs, oxygen, needs cane. So at 4 o'clock, I placed an order for those equipment to our Kaiser National Office. And by 7 o'clock, a truckload of durable medical equipment actually arrived at the evacuation center. In October is when I experienced and saw what it's like to live our Kaiser mission and vision, to be there for our members and to be there for our community. I'm very proud to be a member of Kaiser Permanente.
So I called my boss, and there are a couple of us nurses with hospice that live in Napa, and so there were several of us that did welfare checks for our patients. One of our patients had actually been evacuated. He lived up Soda Canyon, which was one of the roads where the fires originally started, and he had an emergent evacuation where his family called the caregiver and said, "We're on our way." And he didn't want to leave his home, and the fire was racing down the hill. And so the son told the caregiver, "I'm coming," and the caregiver got the gentleman out into out, and they got him out, and his house burned down that night. And so that weekend I went to see him because he had a big decline, and he was in a hotel here in Napa. And when I was there, he actually ended up passing away that weekend in the hotel. And it was just I feel like surreal is such the word, because it was so surreal, because here we are, he's in his final hours of life. His house is burned down, all of his belongings, and his family was there, some of whom had been evacuated from their home, and they didn't even know if their house was still standing. And here they are, and they just said, "This is it. Like, this is what we're doing right now, is we're here with him." But I just thought, I couldn't imagine how much must have been going on for them to know that maybe their house burned down, maybe it didn't. Their fathers had burned down, all of these belongings, all of these memories. So that was such a powerful afternoon of spending time with people who had not only lost their home, maybe lost a second home, and then lost their father, all in this period of time.
While the fires were not burning in Solano County, they were headed our way over the Atlas Peak Ridge. The Green Valley area was evacuated, and 3 school districts in the area shut down, affecting 81,000 students. Many community members came to the evacuation site at Solano Community College.
Our leadership team asked if I would be willing to head out to the Solano Community College to help set up tents and medical aid for our community, since the winds had shifted and there was worry that the Napa fires were headed to Fairfield. We didn't really know what exactly the community needed, but we wanted to make sure we had a private area for them to talk to a clinician. And that's what we pretty much focused on, is setting up this clinic, and in parallel, helping out community members with prescription needs, minor abrasions, and at times it turned into veterinary care. And what I found really rewarding was to see all of these clinicians collaborating with the Salvation Army, collaborating with the Sheriff's Department, collaborating with the Solano Community College leadership team, and really becoming a united family there for the purpose of helping out our community.
We quickly assembled a team here in Fairfield. So there was myself, our nurse, our site lead, Delana Harris from Community Affairs. We all got together, quickly figured out what we needed, and headed out to Solano Community College. And I think the thing that struck me there is we arrive on site. Clinic Olay was there. We quickly talked with them, figured out what we needed. The Solano County Health Department was then quickly out there. And so amongst the group of us, we were all working together to figure out what needed to be done. You know, on a personal level, it was very kind of satisfying for me because both my wife, who's a Kaiser Permanente physician, Catherine Holder, and my daughter, Sophia, both got to help participate in providing support at Solano Community College. It truly is amazing what we as Kaiser Permanente can do locally, both as an organization and with the other organizations in our community.
I received a call from Dr. Walker, our physician-in-chief, and was notified that our help was needed at the Solano Community College Evacuation Center. And so that's where I ended up. Part of the reason I joined Kaiser was the emphasis on supporting our community, and this was an opportunity to do just that. When I arrived at the evacuation site, I was blown away by a couple of things. One was just how many different groups of people within Kaiser, the staff, the providers, and other community organizations like the Salvation Army and the Red Cross were really coming together, showing their compassion and supporting those who were really in need of the support at the time. I think that there were people around me who were worried about their own homes being evacuated, that were checking on their phones to see had their area been evacuated. They were in danger zones, and they still were there, showing up, providing support, being there for each other, demonstrating that resilience to support each other.
I remember walking in about lunchtime and just realizing that people were shell-shocked. And while the medical needs at the moment weren't huge, it was obvious that we were going to be helping people just process what had just happened to them. And it really had to change a mode from, do I need a Band-Aid or do I need a prescription, to how do we make people feel okay in a crazy and chaotic situation. The next morning, Chris called again and said they needed a physician Wednesday morning, and things drastically changed. My vision, my emotional vision of Napa is just walking into one of the most, it was almost like a deep fog around the college. Ash was everywhere. I'd never seen something so dark during the middle of a day or early in the morning when the sun should be out. And it just had this heavy feeling. Walking into their gym, and they had hundreds of people already in that gym. It was, cots everywhere, people milling everywhere, and thinking that I was going to be the one physician to try to help them with their medical needs was a bit overwhelming. I have to say that this was the place that I learned about how people pulled their silos down inside Kaiser Permanente. I got there, and there was Dr. Clary. It seemed like he had spent the entire night there. He was furiously running around making sure that things were all settled for the day. Really made it quite easy for me because he had already set a pattern in place, and he'd already made connections with other organizations. He introduced me to the folks from Olay Health, to the folks from the county who were doing help, and we banded together and decided to be medical providers together for anybody who was there. And what an experience it was that morning. In 2 hours' time, the staff of my pediatrics department gathered $650. They put it together in just cold hard cash. One of the medical assistants ran to the pharmacy to see what they had to volunteer, and they actually had just our giveaway pill carriers, and they gave her box after box of those so people could organize medicines. And we stuffed that in a car. We ran to a local store and depleted them of every size and shape and color of sweats and sweatshirts that we could find. Stuffed it in the back of the car. And the staff they were so excited. We gathered together at the end of the day. We got done about 5 o'clock, and everybody gathered, and anyone who wanted to go, we drove up together. Some of the staff, some of our medical assistants brought their kids to show them what was going on. And the thing was, I had been there Wednesday morning, and it probably was 200 to 300 people in that gym. And I know overnight those numbers had ballooned. And I walked in, and I just lost my breath. There were people everywhere whatever looked terrible Wednesday morning just looked like utter chaos. The best part about it was that people got to see service in action. I'm running into people like Kim Trude and her husband. They've been lifelong people who believe in the community of Napa, and they're working tirelessly, just meeting anybody's needs. There's Dr. Clary again and a myriad of people. They have now set up a clinic that just dwarfed anything we had done 2 days earlier. They had a full pharmacy working. They had screens up and places to evaluate people, to meet them in a private spot. And I was so just blown away by the absolute professionalism and expertise that the medical professionals of Napa put together.
People bringing in food items and diapers for children and games to play, people donating their time to keep people busy, cots, you name it. So it was very enriching for me. And again, I felt that just being able to help in a way that I didn't know that I could, and having that avenue to get there was extremely rewarding for me.
I got home, the news was on, and I didn't feel right staying at home. And so I was still supposed to be on vacation for another 2 days. But at that point made the decision to end vacation and go into work. Then I did phone appointments for patients in Napa in the afternoon. I cried on the phone with some patients who lost everything. And then in the evening, I went to the Solano shelters. We would patrol the parking lot to see if we could give any care in the middle of the parking lot of this community college. And we had a lot of patients who we thought should be seen in the clinic or in the hospital, but refused to because they didn't want to leave their pets, and then they didn't want to leave their stuff. And the fire was right over the ridge. They didn't want to take that risk of losing their stuff just to go into the hospital because of their breathing problem. And so we did a lot more care there than I thought we could. We gave care to a 2.5-year-old girl who was having a seizure. And when the girl was having a seizure, all walls broke down. There were no titles. There was no hierarchy. We were just people. I was not the doctor. This person was not the pharmacy tech. This person was not the administrator. We were all just people there to help. And we got the seizures under control. The girl didn't have to go to the emergency room. The family was super grateful, and we all breathed a sigh of relief because we thought we were able to do something as a team. People would walk by the shelter and they would just stop and say, "Thank you, Kaiser, for being here. I don't need any help right now, but thank you for being here."
And while we were focused on what was happening in the Napa Solano area, we didn't want to lose sight of how we could help our Santa Rosa colleagues get back up and running.
Turn the news on, and it's that first image of Santa Rosa being evacuated. So I just get my phone out, pull up my emails, and just see, command center going on, where they were transferring patients to, and quickly realizing I would not be able to make it to work either. So seeing what I could do, reaching out to San Rafael, Santa Rosa counterparts to see of where I could be in assistance, and just kind of letting Martin know, stand by, and we'll kind of see next steps of what's going on today. So a few days later, we were asked, Santa Rosa had to throw away everything in the hospital, all their supplies after they evacuated due to smoke damage. I don't know the dollar amount, but it was every unit throughout that hospital was empty. And so they asked, if we could build a team of people from Vallejo to come out to Santa Rosa to help out. And I think that first day we got there about 4:30 in the morning.
Yes, about 4:30, yes. They already had a few crews from other facilities that was there. We kind of just jumped in, introduced ourselves, and started helping out. It was great teamwork. I really liked it because it was a chance to help out, give back, and and try to rebuild another fellow facility,
Yeah, it really brought out just different emotions, just being in the area, understanding what was going on in Napa, Solano, then working alongside people that, live in Santa Rosa. A lot of them have either already lost their house or evacuated, but to see them out here to get that hospital turned around because, they had to get the hospital open to care for the patients. And, I was just really proud to be a part of it and see my team make an impact during that time.
It was pretty intense that morning when me and a fellow coworker drove down from Vacaville. It was 4 a.m. and it was really smoky. It was kind of pretty intense. Also to realize that people lost their homes, let alone that it was a real big natural disaster. But when my boss asked me to do it, I never hesitated. I love to help others, and was happy that I could help out the other Kaiser facility.
I had a couple of different roles. When we got the call from our manager, he let me know that he needed me to basically stay here and hold down our receiving area. I came in probably about 4 a.m. The whole week and stayed till probably about 8:30 at night. I was called to go to Napa because our storekeeper that worked in Napa, he was in the Petaluma area, so he couldn't make it in. So just going to Napa and just seeing so much smoke, it was difficult to breathe, even with the different machines to help you breathe in the MOB. It was just difficult. Power was shut down. They were running off of a generator. It was pretty difficult, but it was easy to help just because I've done something like that before, helping when people are really in need like that. And it was pretty crazy around here. Just the amount of work that was getting thrown to us, the amount of people that continue to pour in, it was really busy, but there's no question that whatever the job needed to be done, we were going to get it done and help out and stay as long as we could.
The day of the fire, I was working here at the hospital. I did my shift. I was asked if I could go to help in Santa Rosa. My job was to unload trucks, break down pallets in the station for different departments. After I did that for a few hours, everything that wasn't needed because they sent orders without knowing what the hospital needed. So that was double, triple ordered items. So we have to restock on pallets and put them back in trucks so we can send them back.
For me, I was here. I worked the evening shift. Adam asked me to come in the next day, so I arrived there at 4 a.m. We started immediately stocking up their storeroom and just helping them any way that we could. It was great to have management there working with us as well. There was a lot of management. We all worked as a team. I thought that was really great.
The next day, during a break, we went to the top of the parking structure, and it was, for me, it was very difficult to see all these structures burned down to the ground. People have no more places to live, and it's just hard to imagine going through one of those situations.
Thank you all for all your heroic efforts, for leading the way and being what I call the first responders through healthcare.
I just want to finish by saying how honored I am by the work that these teams did. And as I've served in this role, what I've noted is the service that we saw during the fires is the service that happens every single day in our medical centers. Selfless people, mission-driven, doing what it takes and showing up for others. And it is part of our DNA. It's part of what makes us. And it's going to be part of what takes us into the next century as the people that provide healthcare for both these counties and my hope is this nation. And I just thank these teams, and I'm humble and proud to be a part of this group.